Welcome dear student in my course Determinant of Quality Life. Today we will discuss the miscellaneous determinant of the quality of life. Under this topic we discuss about the interpersonal communication skills. Content of this module are miscellaneous determinants of quality of life and communication, effective communication, how communication affect quality of life, benefit of good communication, importance of good communication, barriers of effective communication, component of communications, styles of communication, best style of communication, active listening, empathetic listening, quality care through communication excellence. Now we discuss miscellaneous determinant of quality of life for personality and life skill development. Under this miscellaneous determinant of quality of life, we discuss effective communication, emotional intelligence, critical thinking, financial literacy, time management, adaptability and resilience, digital literacy and safety, civic awareness and responsibility, teamwork and leadership, one by one. In present module, we discuss about the interpersonal communication as effective communication for quality of life. Learning objectives of the effective communication, interpersonal communication are: after the completion of this module, learners will be able to define communication and identify its role in human interaction. Learner will be able to describe the characteristics of effective communication and explain how it enhances mutual understanding. Student will be able to analyze the relationship between communication quality and overall well-being and evaluate its impact on personal and professional life. The student will be able to list the key benefits of good communication in different contexts, that is in healthcare, workplace and relationship. The student will be able to discuss why effective communication is essential for building trust, resolving conflict and promoting collaboration. A student will be able to identify common barriers to effective communication and propose strategies to overcome them. A student will be able to recognize and explain the main component of communication, that are sender, message, medium, receiver and feedback. A student will be able to practice empathetic listening technique and evaluate their role in building emotional connection and trust. A student will be able to demonstrate the practice of active listening and apply it to enhance communication in personal and professional contexts. A student will be able to define assertive communication and identify its key characteristics. A student will be able to explain the difference between assertive, passive and aggressive communication style. A student will be able to demonstrate assertive communication technique in a real life or stimulated interaction. A student will be able to compare the outcomes of different communication styles in conflict resolutions. A student will be able to compare the outcomes of different communication styles in conflict resolution. A student will be able to compare communication styles, that is assertive, passive, aggressive and passive-aggressive, and justify which is most effective in various situations. A student will be able to develop strategies or role-play scenarios that incorporate assertive communication skills in professional and personal context. Communication. Communication derived from the Latin word communico or communicare, which means share. Communication essentially means the transfer of messages, informations, ideas, feeling, plans from one person to other person in encoding to decoding form. That is the ideas as the internal noises to send to the other person as internal and somatic noises. Message transmitted by the one person and received by the other person is called communication. Communication competence. Communication competence refers to the knowledge of effective and appropriate communication patterns and the ability to use and adapt the knowledge in the various contexts. Competent communicators. To be a competent communicators, you should have cognitive knowledge about communication based on observation and instructions. Understand that individual, social and cultural contexts affect competence and be able to adapt to those various contexts. Effective communication. Effective only when it gets desired action or response. If communications are effective when it is the process of meaningful interaction. Effective communication is a fundamental determinant of quality of life, impacting personal relationship, career success, mental health, and overall well-being. It enables individuals to connect with others, express their needs and feelings, and participate meaningfully in social and professional settings. How communication affects quality of life? We discuss one by one. As first is personal relationship. Building and maintaining bonds. Good communication fosters trust, understanding, and empathy in relationships. In conflict resolution, clear and respectful communication helps navigate disagreements and strengthen relationships. Social connection. Effective communication allows individuals to form and maintain social connection, reducing loneliness and promoting a sense of belongingness that enhance personal relationship, that is good for social and psychological relationship and remove the loneliness. Next is career success. Under this, first is job performance. Communication skills are essential for collaboration, teamwork, and leadership. Professional networking. Communication skills are essential for professional networking. Effective communication helps build relationships with colleagues, clients, and supervisors, leading to career advancement. Public speaking and presentation skills. Strong communication skills are crucial for presenting ideas, influencing others, and advancing within a career. Next is mental health, self-esteem and confidence. Effective communication can increase self-confidence and positive self-image. Stress management. Clear communication can help manage stress and conflict, leading to improved mental well-being. Emotional support. Strong communication skills allow individuals to seek and other emotional support, fostering resilience and coping mechanism. Social participation. Community engagement. Effective communication enables an individual to participate in community activities, volunteer opportunities, and civic engagement. Social inclusion. Communication skills are essential for navigating social situations, forming friendship, and avoiding social isolation. Cultural awareness. Understanding different communication styles and cultural nuance allows for more inclusive and respectful interaction. Other important factors are active listening. Paying attention and understanding others' perspectives is crucial for building a strong relationship and resolving conflicts. Non-verbal communication. Understanding and interpreting non-verbal cues such as body language, tone of voice is essential for effective communication. Communication in healthcare. Clear communication between patient, healthcare providers, and families is vital for accurate diagnosis, treatment and plans, and overall patient well-being. Language access. For individuals with limited English proficiency, access to language services and interpreters is crucial for effective communication and healthcare. Adaptability. Adjusting communication style to different situations and audience is essential for effective communication. Benefits of good communication. Enhance self-awareness. Reflecting on your communication style and how it impacts others helps you understand your own personality better. Improved social skills. Clear and effective communication fosters a stronger connection, leading to more fulfilling relationships. Increase confidence. When you feel comfortable expressing yourself and being heard, your confidence grows. Leadership development. Strong communication skills are vital for effective leadership, enabling you to inspire and motivate others. Empathy and emotional intelligence. Being able to understand and respond to the emotion of others build empathy and a stronger relationship. Effective communication fosters deeper connections with family, friends, and colleagues. Better problem solving. Open the honest communication. Facilitate better teamwork and problem solving. Career advancement. Strong communication skills are essential for professional success, allowing you to effectively lead, present, and collaborate. Personal growth. Developing your communication skills and personality leads to increased self-awareness, confidence, and overall well-being. Importance of good communication for healthy relationship. Letting people know what you want, getting help, express your affections, saying thank you, apologizing, working in a team, explaining technical faults, maintaining healthy relationships. The art of persuasion. Health and safety, rising of the occasion, reaching a decision, avoiding misunderstanding, giving direction, getting the best deal, engaging with the community, and public speaking. Barriers of the effective communication. Barriers at the individual communication is language deficiency. Beneficiary are illiteracy or low level of literacy. Environment is physical. Next is excessive use of jargon. Beneficiaries are superstitions and environment is long waiting period. Next is unempathetic, that due to the religious and cultural belief that are lengthy complaints and its compliance. Next is frequent interruptions. Beneficiaries are preconceived notions and environment is poor signage. Preoccupation with personal matters. Beneficiary are intimidated by status of healthcare professionals of hospital setting. Lack of clear delegation of duties and inefficiency in experience and prejudice are the barriers of effective communication. Component of communication modes. Verbal words, 7% vocal or written. Verbal paralinguistics are 38%. The way something is said, there are accent, tone or voice modulation. Non-verbal body language, that is the 55%. what the speaker look like, such as appearance, dress, emotions on face, posture, gesture, movement. Feeling and attitude are silently communicated. That is the mode you see in the diagram. In eye contact, facial expression shows the happiness, gestures that show the time out, and body posture, that is the angry man. Component of communications are source, message, channel, receiver, feedback, environment, context, and interferences. The same and universal facial expression of emotions are happy, surprise, contempt, sadness, anger, disgust, and fear. Style of communication. Assertive communication, that's our straight talk, putting your point of view across without getting angry. Protecting your own right without violating the right of others. The goals of the assertive person is to communicate with respect and understand each other to find a solution to the problem. Passive communication, avoid conflict at all cost, allows others to dominate and infringe on their right, remain silent out of fear, have low self-esteem and feel insecure, create lose-win situations, little risk involved, very safe, little eye contact, usually quiet tone. Example of passive communications are, I don't know, whatever you think, I have more experience than I, you have more experience than I, you decide, I will go with where the group decide, I don't care, it doesn't matter to me, yes, 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 then no. Assertive communication, respecting both the communicators and the receiver. But in passive communication, disrespecting self as discussed in earlier slide. Aggressive communication, disrespecting others. Passive aggressive communication, passive on the face, aggressive behind the back, forfeiting your own right initially, followed by manipulation and vengeance later. The goal of this style is to avoid conflict and then take the revenge. Have negative emotions, but expression do not match their feeling. Subtly use sabotage to get even. Pretend to cooperate, but covertly work to be disruptive. Which is the best style? All styles have their proper place and use. Assertive communication is the healthiest communication style. When passivity is appropriate, when the results of pushing the issue would cause problem that outweigh the benefits, when issues are minor, when there is a power differential that is not in your favor and the other party is getting agitated by your assertiveness. Which is the best style? All styles have their proper place and use. Assertive communication is healthiest. When passivity is appropriate, when the result of pushing the issue would cause problem that outweighed the benefit, when issues are minor, when there is a power differential that is not in your favor and our other party is getting agitated by your assertion, when aggressive is appropriate, in an emergency, when there is no time to spend on a compromise. When your opinion is based on several facts, you therefore know you are right and there is no time to utilize assertiveness skills. How to have assertive communication? I statement. American psychologist Thomas Gordon in 1960 allow one to express himself and avoid conflict. Statement of what I want, what I need, what I feel, what I think, and what I expect. Question regarding the fact, a solution, their behavior. Can we check the fact? Can we work on solution? Open questions. Don't use why, accusing, blaming. Postures are assertive and eye contact. Active listening. Active listening means process of receiving, interpreting and responding to message. Secret formula is E2H2. Because in active listening, all the organs involved in listening, that's us ear and eyes, head and heart. Art of listening. If we were meant to talk more than listening, we would have two mouths and one ear. Said by Mark Twain. Hearing versus listening. Hearing is an event. Hearing is automatic. Hearing is casual. Hearing is random. Hearing is compulsory and a passive process. But listening is a process. Listening is planned. Listening is structured. Listening is meaningful. Listening is optional. Listening is an active process. In listening, you can choose to listen or not to listen. Listeners are not born. They are made by training. Stephen Covey's listening continuum are ignoring, pretend listening and selective listening. Active listening by Carl Rogers. Active listening means being attentive to what someone is saying with the goals to understand his views, thoughts, feeling and perception, with accept, respect and hold judgment and stop talking. Empathetic listening, the technique can be learnt with sincerity and genuine concern for patient problems or students' problem. The skill will be automatically. How to listen actively. Do's and don't. In do's, non-verbal communication is our appearance. Stop what you are doing at the time of listening. Concentrate entirely on what is being said. Sitting or standing in close proximity. Posture way of standing or sitting. Gesture, nodding, shaking hand, pointing and waving. Positive facial expression is smile and frowning. Eye contact, touch. Paralinguistic listening activity that you do under the active listening are tone, silence, speed and emphasis. How to listen actively? Those in verbal skills are never interrupt during listening. Encouraging words. Use encouraging words and ask open-ended questions. Ask clarification questions. Paraphrasing and summarizing. Don't do anything in active listening are shaking, pointing at figures, fidgeting, deep and loud see, multiple watch or clock check. Continuing with an activity while other is talking. Walking away. Empathetic listening. Empathetic listening is a sincere attempt on the part of listener to understand in depth what the speaker is saying. It requires putting the listener in the speaker's place, seeing things from the speaker's viewpoint, understanding how the speaker feels, understanding not only the words but also the feeling underneath. Listen with your ears, eyes and heart. Quality care through communication excellence. Identify key employees, controlling authority, CHI and understaff, etc. Given them rigorous communication skill training to all the students and members of the faculty. Each of these will prepare modules to train member in their own department and impart training. Assess the effectiveness parameter, beneficiary satisfactions, number of complaints against the sanitation and other things, number of complaints against the colleagues, level of stress and job satisfactions. Never forget to spend few minutes with beneficiaries. Bridge the gap by follow given mannerism. Extend hand for shake hand, showing belongingness. Smile and greet, showing a sense, fragrance of friendliness and cooperation. Always show your attentiveness toward beneficiaries. Speaking is a silver and listening is a gold. You give preference to beneficiaries to speak to least 20 seconds and make eye contact. Keep looking the student or patient. Use hand gesture for communication. Avoid excessive technical jargon. Beneficiaries should have questions. Thank you.